There is no one outside your organization that could possibly imagine what you're capable of better than the people who work for you.
One of the things that's really coming through for me as you're sharing this as well is you seem to be such a champion of your people.
My role is really to remove obstacles, create the space for, and paint the vision for a very talented team. When we're working on things, we're working on the right things. That's all innovation means to me.
Welcome back to CEO Behind the Scenes. I'm Lara Necessian, and today we're looking at leadership that truly transforms not just companies, but industries. Joining me is Sarah Chavarria, President and CEO of Delta Dental of California, one of the nation's largest dental benefits providers. Under Sarah's leadership, the organization is connecting oral health to overall well-being in bold, innovative ways, from launching an in-house innovation clinic to reimagining the role of technology, talent, and trust in healthcare. In this episode, we explore how Sarah is unleashing potential across her teams, driving transformation, and proving that great leadership is more about asking the right questions than having all the answers. Please enjoy. Sarah, welcome to the show.
Oh, thank you so much. Thanks for having me.
I'm so thrilled to have you here. And where I would really love to start with you is your intentionality behind making oral health such a pivotal part to overall health. Could you speak to how you're really bringing this mission to life?
I have been working in healthcare since '99, and I've worked on the hospital side. And more personally, I've been, a parent to young children. I've taken care of my father-in-law, and others. And so this desire to wake up in the morning and get to do a job where I'm thinking about what does the patient need and how do we help connect patients to access to care? So enter oral health, which is your visit to the dentist. That is such an incredible place to think about as a healthcare touch point. You're talking to a healthcare professional and they're doing more than cleaning your teeth. They're doing an oral health scan. They're a really great place to ask questions. So it was an amazing opportunity for us to think about, okay, for 70 years, we've provided a dental insurance benefit, which gives people access to care. And we're talking about 31 million Americans plus, right? And how do we attach that to that preventative care, which all of us in healthcare would love for people to get screened, for people to understand their own health journey, their own wellness. We know that 27 million Americans, they don't go to their primary care physician, but they go to their dentist twice. So this transformation really started with, a great opportunity to say, what if we reframe that dental visit as part of preventative health and really invite the dentists to play that role in a new way, maybe in the same way for some of them, but more importantly for patients to think about, okay, I'm going to a checkup, which, if we're really successful in connecting that, then we get to play a bigger part at the healthcare table, which is, I think, where we want all our patients to be, which is on the front end.
I love this vision and the way that you've described it. And I'm curious to know, what are some of the things that you've really started to implement and put in place in order to shift the dreaded, sometimes dental visit to something that people proactively wish to do? Because thinking about going to the dentist is sometimes something that people do tend to put off quite a little bit. How are you really starting to shift that paradigm and that messaging to make it more of a somewhat enjoyable experience? And the way you're describing it is almost just part of your general health and self-care practices.
Well, let's start with 70 years of insights and data to how people go to the dentist across communities, across generations. I mean, we can see of the people we provide benefits to kind of what's the behavior. And we know a lot of things like getting your children in younger and getting that care probably saves them some of the visits we're all afraid of later down the line, like tooth extractions and things like that. But I think just in the last probably 5 years, 6 years, 7 years, as we've really started this transformation, we've gone in search of new insights. Like, what are people calling about? What do we know about the relationship between oral health and cardiovascular health? What do we know about the relationship between oral health and diabetes or dementia? Bringing those insights and those questions before those insights, right, to some of the conversations has really helped us think about the conversations we have with our clients who, in large part, provide this benefit for their employees and for their employees' loved ones. And then also finding new ways to reach the population to say, hey, for example, as a woman, we've learned that 83% of us who have entered perimenopause or menopause haven't made a connection between that dry mouth or that burning tongue or that periodontal, disease or look and feel to the fact that that's what we're going through hormonally. And so we've done a lot of work in the last few years to publish information, publish what we've learned, and connect with patients in new ways. And I think that's doing a lot to really start to shift that mindset. There's a lot of work left to do, but we're seeing some really small moves and some small steps toward people really appreciating that when they go to the dentist, that connection between what the dentist is, exploring, looking at, finding, talking about is connected to their overall health. So we're still in the fun, innovative stage where we're asking questions, we're doing surveys, we're tapping into science and experts and really trying to build those stories so that we own the narrative as I think, incredible brand with 70 years of experience, whom, lots of people trust with their oral health. We're bringing that new information to the table in different ways. And I think that's a big shift for us.
And one of the things that you touched on is innovation. And you recently opened up an innovation clinic, which I read within the first week of opening quite literally saved a life. Could you share more about that story and what that moment really felt like for you as a leader?
Thanks for asking about that really specifically, because 7, 8 years ago, I would have never thought we would open a dental clinic in partnership with a provider. But, we got to the point where we said, how better to learn and really explore what some of these connections are than to play in that space and put ourselves in those shoes. So we opened an innovation center clinic in Oakland, California. So right city center. And we opened it with the idea that we would test some dental medical integration things like, let's take every patient's blood pressure. Let's take every patient's A1C, which, yes, that's a little needle prick. Let's ask them about their mental health. And let's do a couple of things that are innovative and new. We had I was the first patient, 1:00 on August 25th. And then we had 65 patients scheduled for the first 2 weeks. By the time we got to the 60th patient, we had a woman come in the clinic and she was feeling fine. And when she sat in the chair and they took her blood pressure, it was very, very high. And so she was referred by the dentist to her primary care physician and asked to go to urgent care. And so she did. She went to urgent care and she called us later that afternoon and said that the urgent care doctor told her that we may have saved her life because her blood pressure, it was so high. And then she followed up with her primary care physician. I mean, that story happening within the span of 60 patients when we've just opened this clinic That's why I feel compelled to come to work and innovate and really think about how do we make that possible for all patients to experience at their dentists. We know a lot of dentists are doing this today, but how do we build that into what one should expect? And then with the A1C, the needle prick, in that same period of time, we had 2 patients present with high glucose. Their doctors changed their regimen as a result. That's incredible. And then we had a third patient who had an error, which showed that their hemoglobin was really low. That patient hadn't been to a doctor in 6 years. That's exactly why we're innovating and learning so that we can tell those stories and then invite our provider community to partner with us about how do we bring that access to all the patients, right? So
I'm curious to know on this thread of innovation, what does innovation really mean and look like for you? Like, what are you thinking about? Is it more so about the technology side? Is it about people? Is it about mindset? A combination of all of those elements? Like, how do you really think about and approach innovation as it pertains to your industry?
you're making me laugh because this is one of our values as a company, right? We want to be innovative. And I cannot tell you how many rooms I sat in my early years, so 8 years ago, 7 years ago, where they would ask me, well, Sarah, is that innovation with a big I or a little I? And I was like, what? Like, what are you talking about? It's just innovation. It could be anything. So it's all of those things. It's an employee whose job it has been for 15 years to photocopy some materials and then repackage them for somewhere else, saying, should we still be doing this in the digital age? And maybe there's a better way, right? It can be that tiny to innovating around, hey, let's test taking blood pressure at the chair side. And what does that look like in the healthcare continuum if the dentist is one of those preventative touch points? It's reimagining technology. I mean, look, I always give the example that my father, who was retired military, he knew where his insurance card was. He went to the dentist he was assigned, and his appointment never changed. And it was 3 months out, and he was ready. And then my 26-year-old son has no idea what an insurance card is. And when he wants to go to the dentist, he just woke up this morning and decided, yeah, I probably need to go. And he wants to go like tomorrow and has, a very digital forward experience. I mean, look, we're 70 years old. I mean, our systems have been long in place. They're long embedded in how we do our work, which is, you think about 31 million Americans going to the dentist. I mean, that's a lot of claims. It's a lot of material. It's innovating around how do you create a digital experience for my son while still creating an experience that my father can participate in. And how do you do that all at the same time? So innovation can be big I, little I, sideways I don't really care, but it's about people feeling like we work for this purpose-driven organization, right? We're nonprofit, and I can come to work and bring an idea, and someone's going to listen to that. And then we'll see, how does that idea better the experience either for us internally or for the patient or for the provider or for any stakeholder? And then we prioritize that, right? Because at the end of the day, I only have limited time, resources, capital, and effort. That's what innovation means. I think it starts with mindset and a belief that I can bring a meaningful question or meaningful experience to the table and change the conversation so that when we're working on things, we're working on the right things. That's all innovation means to me.
And how have you really cultivated this culture of innovation in the workplace? How do you practically encourage your team to come forth and bring their ideas to the table in this way?
Oh, so we could have hours and hours of conversation. This is like my favorite topic is how do you think about, and I always think about them in three pieces, right? Strategy, structure, culture. So if you touch one, you have to touch all of them. And the culture piece gets missed a lot. But I'll tell you about something we've done really recently that I just knew was going to be great. But I will say there were people who were very, very nervous on my team and across my team. So I think organizations, we are no different. We spend a lot of time talking about who are the people in our organization who perform really well and show incredible potential. And how do you tap into them, engage them, and really help them be part of the organization? So I write a strategic plan with my team every year, like most companies do. But with our innovation focus, I want a strategic plan that tells the story for where are we going to be in 5 years. And so I told my team, we're going to do something really bold. We're going to pull those people that we say show potential and perform really, really well, and we're going to put them on tiger teams. And what I mean is, I want you to give them to me. Like 90% of their workday for the next 180 days is going to be fully focused on these 6 topics. I identified 6 topics like what communities should we be focused on to improve oral health? How should we think about seniors and the growing number of seniors when we think about connecting them to oral health, et cetera, 4 more teams. And we've put 3 people on each team from our very talented pool of individual contributors, directors, kind of all across. And the only ask was check your title at the door and steep yourself in imagining where should we be by 2030 in your topic area, and how should we get there? And it has been incredible. I was just talking to one of the young ladies on one of the teams this morning, and I said, just at the 60-day mark, so they've just crossed the 60-day mark, and they did a little report out, I've already pulled an incredible nugget from each of the 6 teams that has made it worth it. And they still have a couple of months to go. So I can't wait. And they're going to write the strategic plan for 2030. That's tapping into innovation. It's believing that, I'm not going to write it and have the imagination, the creativity, and the insights to know all the answers to where we should be in 2030. My team brings biases, right? And so we're not going to write it. But these are the folks who are close to the patient, close to the provider. They're, still at a point in their career where their imagination can embrace the what's possible. And I've just asked that none of us meddle with them. So we leave them alone and that we support them by connecting them to the parts of the organization that can answer a question, enable an AI tool that they might need. And I think this has been probably one of the most exciting things we've done around innovation because it really has unleashed the real potential of this talent in the organization to write this strategic plan. And I will tell you, there is no one outside your organization that could possibly imagine what you're capable of better than the people who work for you. So just as one example of what we've done, I think that is huge. And they're going to write it. We're not meddling. So they're going to write it. And we're going to find ways to think through how do we reprioritize within our core business to really bring that about. It's exciting as a leader. I see I think my role is to really make sure that the up and coming people have the opportunities. And in this seat as CEO, I can make those possible. And so it's been really fun.
That is so fun. And I feel like this concept of tiger teams is such a bold leadership move to have made, because to make a call to pull out these top performers for 180 days, to take them away from their business as usual, to be able to focus on innovation, it takes a lot to actually not just think about doing something like that, but to bring it forth into motion. And so, what was it that really inspired that decision to begin with? Was it just this desire and commitment to continually innovate and evolve, or was there something else behind that thought process?
I spent my whole career on the people side of organizations, driving change, driving transformation, thinking about talent. And so for me, it was we had just come out of our talent conversations. And, I think we all get stuck kind of thinking about what are the opportunities for people that are up or once in a while across, because at the end of the day, you don't want to lose your most talented people. So was that piece. But the other piece was truly like, who is going to imagineer where we're going by 2030? I can't pull enough people in a room enough days to get all that up on a whiteboard and then kind of render it. And I don't want to buy it from someone outside because I just don't believe that the space we're talking about is something other people are thinking about. And so I couldn't imagine getting something really great, right? So when you marry the who is going to kind of put the ideas down and then mobilize those ideas, and then you couple that with, and we have all this incredible talent and we want them to stay and feel engaged, and they're our future leaders. Well, let's kind of put that together and have them shape, well, here's what we're going to do for the next 5 years on the innovation side, and then steep them into spending time with some of us on, okay, now how do you size that into the strategic plans for each year? And how do you play with your portfolio commitments to make sure the technologies that you need are supported? And then how do you change the mindset of the organization? So it's this really beautiful, I make it sound, it's hindsight, right? So I've learned a lot just having had them engaged for a little over 60 days. But even going in, I just knew. I know a lot of these folks. I hadn't spent a lot of time with others, but these are again, they're just very incredibly talented people who are close to the business. And you put them together on these key topics that aren't their subject matter expertise, they're going to do amazing things. And I will say, for anybody listening who thinks like, oh, this is such a great idea, separate them from their job, because side of desk Tiger Team is not going to work. We left 10% simply because we didn't want them to feel abandoned, right? So we wanted them included in big meetings. We wanted them to feel included if the team got together on a project they had left behind. But we really did want them to step away from their job and imagine what happens for the people on their teams. It's such a great opportunity for them to step up across in. So you're really developing some incredible capabilities across the organization. I'll report back when it's all done. But from what I can see today, I've already gotten plenty, and I think that they're all going to work really hard to deliver this path to 2030, which we're going to put in motion.
Absolutely. It's such a brilliant concept. It really is. And I think one of the key things that you just touched on is actually the proportion in which they're still remaining connected to their roles, but not actually expecting them to innovate while still doing the full spectrum of their roles. Because I see in a lot of organizations and through my own experience where people get pulled onto these types of projects, which sounds very fun and exciting, but can often have the consequence of them being pulled in too many different directions. But the fact that you've created it in this way where they've got the time and space to be able to really think, create, ideate, innovate is having really amazing ripple effects within just a 60-day period. So I'm excited to hear how that continues to evolve. And one of the things that's really coming through for me as you're sharing this as well is you seem to be such a champion of your people. In the position of CEO, how have you really learned to cultivate that, nurture that, become a real champion of the people that are working for your organization?
I think it starts with a fundamental belief that, my role is really to remove obstacles, create the space for, and paint the vision for a very talented team. And so I think, investing early in knowing, what are the competencies, capabilities, and experience that you need to deliver on the vision that you're bringing in this role. So I had the benefit of doing that, and I had the benefit of being over the people function before, I stepped into some other roles here. But I think if you start with that premise of my job is to create the vision and then assemble the talent, then it's really easy to build on that philosophy and say, okay, like I tell my team all the time, I don't bring a lot of answers. I bring the question, and the questions are really designed to just help us think differently. I mean, we're in a transformation. So if I were a CEO who came into this role and said, okay, we've been doing this for 70 years and we're going to do it for another 70 exactly the same way, it would be a different leadership philosophy. And, for 70 years, it was very kind of top down, not unusual in healthcare, not unusual in insurance, but, a little more controlling, if you will. We got past that with the last CEO, who was a fantastic partner. I guess I slip into a little bit of a facilitator role when I'm in my own team meetings to really just beg questions around, well, do we like that we do it that way? Or, well, how would we change that conversation if it were different? And really just try to pull and extract from the talent that I have the how we should do it and make it a safe and trusted place to bring new ideas, to try things. And I think, I had a leader very, very, very early in my career, and she used to say, right now, not perfect next year. And I really do try to live by that. Like, if it's good enough, if it feels right, let's just do it. Because if you take too much time to try to perfect it and get all the data wrapped around it, I mean, look, sometimes it's right because it feels right. If it doesn't work, well, then we'll take the lessons from it and it won't work. I see myself as, really organizing and bringing out all of the best that the people who work for us have. And look, I believe people wake up in the morning and they want to do a good job. I really don't believe people wake up and they think, well, I woke up on the wrong side of the bed today. It's going to be crummy and I'm going to ruin it for everybody else. So, if you believe that people really want to do the right thing, then learning how to help them understand what the right thing looks like to you is probably a good thing to do, right? So I try to be more inspiring and motivational around like, hey, I like that. And I always tell people, reward the behavior you like to see. And so if I see someone being brave or being bold around the table, I never forget that I'm sitting in a seat that can acknowledge that in a way that makes that important. I think another thing I've learned, even though I hate the word, is a big part of my role is to give people permission to do things. I mean, I get goosebumps even just saying it to you, but I think that, people have all learned their leadership styles or their contribution styles from whatever leaders they have worked for over the years. And when I give permission to step up, grab the marker and write something different on the board, or go try that, or sure, let's give that a whirl. I think that it even has surprised me how meaningful and powerful that is in leading an organization, because if people feel like they have your permission to behave differently than they have for the last 25 years that they've worked here, then they're going to bring more innovative ideas. You're going to build more trust, and they're really going to feel really tied to the purpose you're trying to deliver on. And so I just try to make sure that I'm creating that environment and then I'm modeling that behavior. If I don't know something, I don't know. And I say, well, I don't know. Let's ask so and so. And I think that's really hard for leaders sometimes because they think they should know everything. And I certainly do not. And I think that's okay. And being honest about that and transparent about that, I think goes a long way to engage employees around who you are and believing in you so that they feel inspired to deliver on your vision, which I think at the end of the day, I mean, that's, what we all hope for is, that you have everybody sitting in your canoe kind of rowing to the same place.
It feels like you've really found this way to not just empower your team through innovation, through permission, through all of these concepts that you've really brought to life within the organization, but you're also holding them to account by role modeling the types of behaviors that you also expect to see of them. So how have you really balanced this empowerment piece with holding your people to account at the same time and managing that duality?
Look, I think there are a few ways, but I think, one of the ways is making it okay to have some healthy conflict in a room. So if someone does something or if someone wants to do something and it's not a good thing for the organization, how do I create an environment around my table and help lean in and facilitate a really tough conversation where, maybe there's a really great idea, but another person just cannot make that happen. And so I think that's one way is really shaping that accountability that we can resolve through conflict toward making decisions. I think another way is owning the mistake and talking about like, okay, well, I thought that was going to work, but, I'm starting to see that maybe that wasn't a great idea and inviting other people to be okay with that. And it happens all the time, right? Like, we're in a business where clients purchase something for us to provide for their employees. And you want to retain and continue to take care of those clients. But every once in a while, it's time, they want to move to someone else. And that's not a failure, right? So it's really about, hey, let's bring that to the table and let's talk about what was it that the client was looking for. And I think that accountability is about having the bravery or the courage to really bring it to the table and then appreciating that accountability is shared across a few of us, right? And we all play a role. And then I think the most stark example is, when there is an error made and how you handle and communicate the interaction with the individual who's made that error, right? Is it something that we can kind of reward the accountability that they've taken because you want them to do that and then respond in coaching and education and making better. And, so I think each of those examples, I think go a really long way to helping to balance that accountability, which at the end of the day, if you create a trusting environment, you're going to have accountability because people are going to feel like they should own what they're about to do or what deprioritizing something means to the timeline of someone else. And, my job again is to make sure that I'm creating the time, the space, the safety to bring those conversations about. And I have a big role in that. I mean, again, it's me knowing, when to lean in, weigh in, ask a question, or slowly start to take the conversation to the resolution part. So there's a lot of roles I think that we get to play in leadership roles to balance that accountability. So.
Absolutely. And in describing your leadership, you referred to some earlier instances in your career, very much around people and really realizing that you wouldn't have been able to project into the future that you would be in this position that you are today. But one of the things that really struck me about your story that came through for me in research for this episode was an early experience that you had during your time with Levi's when you were 25 years old and you were asked to deliver some pretty significant news to people about job cuts. What did that moment teach you about leadership and empathy and how you really wanted to communicate such challenging messages?
This story was so life-changing. So imagine I'm 24, 25, and I get picked by Levi's to get sent to Atlanta to learn, how to present these overhead slides, right? Because back then we had the little overhead slides. I get like my whole binder. So I'm certified through this Train the Trainer program. And I'm 25. I mean, I'm only looking at, ooh, I got picked. I get to go do this. So I get off the plane at my first destination, which is Amarillo, Texas, where there's a plant. And I go in early and I'm wearing my cute little suit and I get everything set up. Here comes the leadership team of this plant. And it's not in my brain that they've worked there for 25, 30 years. They know everybody, right? I'm just like, oh, here they are. I'm ready. And I start talking just like I have been scripted to do. And one of the gentlemen leans back, crosses his arms and says, "You mean to tell me they sent a college punk like you to tell me I'm losing my job?" And I immediately just flashed to him reminding me of my dad, who was a 30-year Army veteran. And how would my dad feel if I was like, so here's what's about to happen? And so, he took me aback, obviously. I mean, I was absolutely not prepared for that. But I stood there for a few minutes and I just looked at him and at the rest of the team because I came from a Levi's plant myself. So I knew my own team. And I said, look, we don't have to do it this way, but I got sent to Atlanta and I have a whole binder of information that probably outlines what's going to happen, how it's going to impact you, and kind of what the next steps are. So we can go through it any way that you want. And I ended up pulling up a chair, and what Levi's was doing was really reorganizing leadership roles because they were going through a big transformation. So it was a good thing to do. It was just, I just showed up without all the context. And it was pivotal for me because I went back home to my own plant and really thought about how does that never happen to me again? And organizationally, like, what would I have been appreciative to know kind of before going into this event? And so my journey on really making a commitment from my role, because, I was a trainer and so worked in HR, was how do you help organizations go through change and how do you impact people? And do you know, to this day, I do not know that gentleman's name, but I can picture him just as clearly as I am looking at you. And I have thought about him so many times, and I've told this story a few times because it really changed my course of wanting to be a trainer, where I was like, here are my materials, facilitator guide, let's go, to I want to help companies really drive change from the people perspective because no one deserves to feel like that. Organizations make decisions, but there's a way to communicate those decisions that is respectful and transparent and gives people, a runway to make decisions and empowers them. And so I spent my whole career from that moment on really focused on how do I help that be better. So it's a great story. And I look back at that little girl and I just think, oh my gosh. I mean, what a funny and hard lesson to learn.
It is a hard lesson to learn. And in a way, it's like learning it at such a pivotal time of your career. You can see how it's really shaped the way that you lead today, which is with heart, with care, with, wanting to communicate things, even though they may be so difficult, with grace and with empathy. And that is a skill that absolutely can be cultivated. But I also think it comes down to compassion and care at a real human level. And I would love to know, as your role and as you've continued to climb in your career, how you've been able to still maintain that care and that compassion towards other people while still driving the business forward.
I think just always pausing long enough to reflect on what's the impact this is going to have. And, I just fundamentally believe that the more information you can provide to prepare people for whatever's going to happen, the better. I mean, sometimes you have to hold, right, because of circumstances, but taking the time to be really thoughtful about who it's going to impact, what it's going to mean, what your role is in sharing it. It's so important. And at the end of the day, I am a people leader. I mean, my job is to say, hey, here's the vision, here's where we're going. But to get 4,000 people excited about coming in every day and doing that work, and then all the stakeholders around us to believe that the transformation we're driving is good for them. And so sometimes you have to make tough decisions, hard decisions, but I never forget that somewhere in that mix of decisions we have to make, there are people. And I think that should always just get brought forward. Like, who are we talking about? How many? And try to just imagine. I mean, it doesn't take long to do that work. I mean, you're talking, it could just take moments in a crisis communication, but who are we talking about, and what is it going to mean to them to learn this? And is there any way to provide that information in a way that they can absorb it or take it in? And then appreciate how people take information in, right? And kind of what they go through when they hear about something. And so I think that it's a big part of my role. Not always. I mean, sometimes, I just say, hey, here's where we're going with this. But then I have to trust and depend on the people on my team to, do that same work. But I don't think it's hard to remember that at the end of the day, most of us work with people. And we are a person and a human. And I think it's a little bit bigger than how would I like to be treated or how would I like to take information in. It's really about, how do the folks that we're talking about, how do they need to hear that information? I mean, take COVID, for example. I mean, my goodness gracious. I mean, we all thought, 30 days at that, at the latest. We were very quick to, probably like a lot of organizations, we made a commitment on day one. We will communicate what we know, when we know it, and how we're thinking about it. And that's just something I live by. And so we got on regular, quick town hall calls, and we're like, here's what we know. And kind of here's how we're thinking about this new information. We don't know what it means yet, but boom, boom, boom. I think that's important. And then look, I've created a lot of really open communication channels with employees in particular. So I get a lot of feedback from employees through open Q&A during town halls where we curate those. I do chats with the chief where we just do ask me anything. And if I don't get to questions, we curate them and then we publish responses to those questions. So I really never forgotten that we're talking about people, and anything I can do to minimize shocking or harsh impacts to people, I want to do. So, I mean, change is change. We've all had terrible things thrown at us that we've had to navigate. But when those things happen, most of us just want information so that we can make decisions that are good for us and timely. So, some pretty easy, basic things, I think, that we just have to remember when we're in these roles sometimes.
And speaking about change, technology is transforming healthcare at lightning speed. If we look at things like data integration, AI, VR, how are you and how is Delta Dental really kind of keeping pace with the lightning speed of technology in the space?
the answer takes a couple of directions. I think first and foremost, we're a healthcare company that sits on information about our members who are patients, and we have an incredible role to safeguard that information, right? So that's a really important layer that we take very, very seriously. Then we've talked a little bit already about the experience that patients expect, the experience that providers expect, and how those are changing, right? I mean, my son and my dad, and then, providers who expect to be able to go on a portal and more quickly interact with us about where's the claim, how am I getting reimbursed for that? What care is covered? Things like that. And so I think that keeping those things in balance for us has really been about thinking through how do we prioritize and then what are our non-negotiables, right? So providers are key. They are the deliverers of care. So dental hygienists and dentists, anything we can prioritize and do to give them time back. I know that sounds terribly cliche, but to make it easier for them to work with us so that they're able to be with their patients more. Those are things we want to prioritize. And so when we think about the rapid advancements in, putting at their office's fingertips, checking who Sarah Chavarria is and what are her benefits and, what does she do for and how do we cover that? We want that to be there and available and immediate. And then the patients, patients go to the dentist twice a year, but they don't think about what they have in terms of their benefits until they're going to the dentist twice a year. And so what are some of the tools that we can prioritize for them, right? And so I think that we spend probably a lot of time, like a lot of organizations do, really thinking through not just how do we balance the care that we need to take with the data that we have with the rapid expectation evolution, right, from our stakeholder perspective, but also internally, sometimes we are looking for how do we prioritize some of our own internal things so that we can give some of our time back and some of our resources back to the innovations we talked about a little bit earlier. And so there's this incredibly complex set of things that we have to keep in balance. But number one is really about providers. I mean, like I said, that's where the patient goes, that's where they receive care, and that's where they really experience us. And we should be a nothing, right? We should be the access, and it should be easy to interact with us so that they have more time with the healthcare professionals. And then, internally really thinking through how do we focus on some things that just give us capacity so we can do more of the thinking around. So how do we support dentists and taking blood pressure? And how do we, create greater access for seniors who live in communities where they may not have a specialist? It's a very complex set of considerations that come into keeping pace with. But I will always be willing to move a little slower if it means safeguarding what I think our number one priority is. So there is that.
Absolutely. And when you think about the innovation within the oral healthcare industry, what is exciting you the most, say, within the next 5 or so years?
I think what has excited me already is no matter where I go and talk about this, everybody always says, yes, of course there's a connection between oral health and health. I mean, that has been incredibly exciting. And then just getting into some of the specifics like oral health and cardiovascular health, oral health and menopause, oral health and seniors, the appetite for that is incredible. But I think the next 5 years, what gets really, really exciting is really finding what is the partnership and role we can play as a company in partnering with other parts of healthcare like hospitals and really impact change there, like answer questions around if we could keep dental cases out of the emergency room by reimagining how a patient with an emergency dental issue gets treated, that's a positive impact to hospitals, right? And the patient has a positive experience too, because now they're not sitting in an emergency room waiting for their abscess to be treated or whatever that is. I think that connecting the medical records. So we made an investment in Epic because in our clinic in Oakland, we're exploring if a patient has their wisdom dental record created and it gets connected to their medical record. Isn't that a good thing when the primary care physician can see the information that the dentist has captured in that visit and vice versa? I mean, I give the example of my 3-year-old grandson. So he was born with a very rare heart condition. And he, for the rest of his life, will have to take an antibiotic 1 hour before he goes to the dentist. If he forgets or he doesn't say that, and the dentist can't see that, I mean, his life could be at risk. And connecting those records means that the dentist would know, because there would be a flag that says, oh, he's a heart baby, a heart teenager, a heart young man. And I'm going to ask him, hey, did you take your antibiotic 1 hour before arriving? And so it's those things that the next 5 years are going to answer for us. It's, making sure that we have a really good understanding of where do we have gaps in access in specific communities, and can we partner with whomever, right? And play a role in bringing oral health to those gaps. And, does that mean, we imagine and support teledentistry companies, or we support dentists coming out of school by helping them find a path to a community that needs them? Those are all of the things that we're working on now to answer those next 5 years, because at the end of the day, our focus is creating access to care, right? And that care be quality care to improve health. And so that's a pretty amazing purpose. And so I think the next 5 years are going to take us down some paths we could not have imagined 10 years ago, for sure.
When you think about legacy, both within the organization and beyond, what is it that the impact you really wish to make?
I think it's twofold. I think one, like any leader, I want the legacy to be that the leaders and future leaders who work for me today feel like they really got to develop themselves and become these amazing leaders wherever they go. I mean, of course, right? I think that healthcare deserves innovation and experience and all these wonderful things. So I hope that in some way, being a part of our organization leaves a beautiful mark, just like Levi's left a beautiful mark on me, right? And they take that. It's awesome. And then I think on the healthcare front, I would love to be a senior kind of looking at my own access to care experience, where the mindset is that everybody thinks about their visit to the dentist as a preventative care visit, and they go there expecting and welcoming having an experience with that hygienist, that dental assistant, and that dentist that look a little bit different than it might look like today, and that they are connecting that experience to their overall health. I had a board member tell me, Sarah, when you retire, you have 2 new best friends, your dentist and your doctor. And I was like, okay, I guess I'm looking forward to that. So, but yeah, I think that legacy is that our brand has another incredible 70 years ahead of it, where we are celebrated as having had the imagination to really close this gap between oral health and overall health. I mean, nothing would delight me more than that being true.
So at CEO Behind the Scenes, we do always wrap up with the same 2 questions. So the first question is, what is one thing you've changed your mind about recently and why?
So I'm going to give a personal example. I am not a beach vacation person. And so I never traveled to Hawaii. I'm like the only person on the West Coast who'd never been there. And I finally went on a trip. It was a work trip. And I have changed my mind. I love it there. And I think the ability to just go to a place where you're looking out at water and everything is like slow motion, I think that's pretty incredible. So I know that's a silly answer, but that was a really big shift for me because it changes my travel for adventure to travel to fill your cup, right? Just kind of, which I'll tie to leadership. I think a lot of us as leaders don't spend enough time what I call cocooning, which is sitting, pausing, reflecting, and reshaping. And I got to do that there, which was nice.
I concur with that concept of cocooning. And I also have to say, I went to Hawaii for the first time last year and I loved it. So I
See?
totally agree with you. And our final question is, what is one thing that you've not changed your mind about, a belief that you'd want to leave behind for others to lead and live better?
I have a whole list of these, but I would say that primary focus for a really great leader from my experience is to be comfortable showing up and asking questions and not knowing the answers and really inviting people to do that. I think connecting people, that's incredible, and listening. The answers to most of the questions we have, they're in the organization. You just have to know where to go and you have to be willing to engage at a variety of teams and at a variety of levels, but it's in there and you can find it.
Well, Sarah, I've so loved this conversation with you and, your insights around leadership and leading with heart. Like it's really brought through, connection, courage, curiosity, and the way that you do things, both within the industry, within your organization, but beyond as well. So thank you so much for joining me for this conversation.
Oh, Lara, this has been a wonderful chat. You made it feel so comfortable. And I've loved talking about Delta Dental and my journey and leadership. What a fun time. Thank you.
And thank you so much to our audience for listening. If you enjoyed this episode, then please be sure to subscribe, rate, and review the show, and also share this episode with someone in your network who you know would really value and gain so much from Sarah's incredible wisdom and shares. Thank you so much for joining us, and we'll see you next time on CEO Behind the Scenes.